microbiology for podiatry. In this subject, you will learn many skills, both practical and theory-based. Some practical skills that were developed over the semester include inoculating agar plates with both bacteria and fungi, the gram staining procedure and the observational techniques used to identify and distinguish different microbes, and how to prevent and reduce the spread of infection through direct contact, such as fist bumping instead of handshaking. Throughout the semester, many microbiological techniques and procedures were learned that will help us treat patients in our scope of practice as podiatrists and will allow us to more accurately diagnose diseases and infections. Efficient identification of these pathogens is important to reduce the risk of transmission and to improve the prognosis for the patients. Throughout the semester, 5 main practical activities were covered. These include gram staining, skin swabs for Staphylococcus aureus and Aspergillus, hand washing technique, tests for reactions of hemolysis, catalase, coagulase and antibiotic sensitivity, and the identification of the different dermatophytes that can cause tinea.
We conducted an experiment to determine how efficiently microbes can spread on the skin when handshaking and fist bumping. Pathogens spread through contact and can become a health risk for podiatrists and patients in a clinical setting. Transmission was greater in handshaking than fist bumping due to a larger surface area of contact. Chlorhexidine 2% was found to be the most effective disinfectant when washing hands due to its antibacterial, antifungal and antiviral properties. Therefore, through the experiment, it was learned that chlorhexidine should be used in the workplace to reduce the risk of spread of infection through contact. A nose swab was also conducted during the semester to determine the percentage of carriers of Staphylococcus aureus and Aspergillus. 33% of students were found to be carriers of Staphylococcus aureus and 0% were carriers of Aspergillus. Carriers of Staphylococcus aureus need to be cautious in a clinical setting to ensure that the infection doesn't spread, especially to patients with open wounds and compromised immune systems. Fungal infections such as onychomycosis and tinea pedis are caused by dermatophytes such as Tritophyton rubrum, Tritophyton mentagophytes, and Microsporum canis. In MMP, we learn to distinguish between these dermatophytes under a microscope on SDA plates by identifying their characteristic features. It is important to recognize the difference between the infections to ensure appropriate treatment, therefore microbiological assessment may be needed. Fungal spores can be present in a podiatrist clinic when using a nail drill. Fungal spores can become airborne, becoming a health hazard for podiatrists and patients. Nail files and rasps can also cause spores to become airborne. Masks and safety glasses should be worn when using these tools to reduce the risk of infection.
Some key points of theory include identifying different pathogens that can be found in a clinical setting and distinguishing symptoms of diseases that can be caused by these pathogens, such as tinea pedis and impetigo. The theoretical knowledge was developed through the lecture content and the practical classes.